And it was quickly realised that the workload was pretty much unmanageable. And so as a consequence, there was the incentive to want to reduce the number of acutes that were coming through the pharmacotherapy team. So we were lucky enough to be given some help from Ashley Hose from Health Improvement Scotland, who came into the practice and helped us look and assess the acutes, assess the process maps that were happening here in the practice, looking at the pathways for that improvement, to see what we could identify as being the problem and see how we could implement ways to make that better for everyone here in the practice. We did it in a variety of ways to begin with. So the over ordering was tackled, patients asking for things before they'd run out, or the pharmacies asking for things before somebody should have run out of their medication. The repeats all being out of sync with each other so that requests were coming in all the time. The near patient testing meds were all changed to permissible repeats, and that took a lot of the bulk of the acutes away. We also changed sensible medications to repeat with no count if they were for a chronic disease, and they were going through reviews via our chronic disease pathway that we've got set up in the practice, or we put them onto permissible count if it was something sensible that the patient had been using for some time. And then the other thing that we had to do, sorry, can you click through these points? I've got it on a different screen and I can see everything. The other thing that we had to do was we found that the way that the acutes were coming into the practice on pieces of paper were getting collected by the staff on just 1 or 2 days of the week, which meant that there was a huge bulk of acute requests on certain days, which was just far too much for the pharmacy team to manage. And we managed to change the way to make it into a consistent flow of acute requests throughout the week. If you click once more, and that way it was a trickle all the time. So we